that it is actually meeting a need. And I went to the factories and met folks and realized that even though they couldn't organize, they were able to have a basic level of living that wasn't provided previously. And okay, just looking at one of the questions here. And so what I'm trying to say is that I understand sometimes when we have ideas, when we want to bring them forward, and we need to, adjust and really look at what are the true issues. After undergrad, I actually opened a school for children. My son was 14 months when I did that. And it was a bilingual English-Spanish program. We taught science, math, languages, of course. And it was really a place for children to explore and have their, or realize their potential at a young age. After that, I went to medical school. I went to the CDU, UCLA Medical Education Program. It's a joint program by Charles R. Drew, University of Medicine and Science, and UCLA. During that time, I actually had another baby, a little girl. And I actually worked in Haiti for over a year after the earthquake, and was there right after the earthquake and helped to set up a disaster relief center. So a lot of the work that I'm doing around COVID stems from the previous work that I've done as far as organizing and we approaching this pandemic from really a disaster perspective. Although we never really put it in that perspective, it really is. And looking at the factors that are needed. After medical school, I actually did a year of family medicine residency in Long Beach Memorial. Then after that, I moved to surgery at Cornell. And after that, I came back to CDU and was able to take on a position of helping to prepare young people to enter the health professions. And so I'm currently the director of our pre-medical academy. The pre-medical academy is a program that's established for specifically first generation college students, Latinx, Black, Southeast Asian students who might not have had the support that they needed in high school, but really still want to become physicians or dentists or chiropractors or podiatrist, pharmacist, optometrist. So really looking into the professional level fields in healthcare, which a lot of times folks from our community don't really see a pathway to. So we're helping to create that pathway and really break down the steps to becoming a health professional. Additionally, I'm the director of our post-bac program. This is a program for students who have gone to college, they've gone to amazing universities, and they had trouble. So a lot of times the professors don't necessarily take students of color under their wing when they tell them that they want to become physicians or pharmacists or other health professionals, because it's a field, they're fields that they don't believe that we belong in. And so that's what we are, that's what we're up against. And I actually experienced that in my undergrad education as well. And I needed to do a post-bac because I didn't have that support. And so we have a group of 45 students who will be applying to medical school this year. A great group of students who are going to be taking their MCAT really soon. And so again, we help provide that support for students. Another thing that I am involved in is just a lot of different committees on campus, scholarship committee, strategic planning. And then with COVID-19, I helped to lead our testing site over the summer. I was also the campus expert on COVID-19 and have been helping with organizing some vaccine efforts as well. And then doing town halls like this, answering questions and really, not giving you the, how would you say, the standard lingo or the pitch that they're giving in the media about masks or about vaccines. And so again, I'm here to speak with you, break down information, and I'll probably be sharing my screen as well, just to show you guys a little bit more. And again, I'm happy to, even if you think that it's like a like not a relevant question, it's okay to ask, because we don't really have a forum other places to ask questions. And so yeah, we'll go ahead and get started.
I think what would be great is if I'll read you the question that's in the chat,
Sure.
and then we can kind of go through the questions. And if it requires more details in terms of the science, and we can bring in the resources for that. But that way we make sure we at least address the ones that are here right now. Okay. So it looks like the first off, what are the side effects of the vaccines?
So one of the things I want to differentiate is a normal reaction and a side effect. So let's just take a step back and think about, what is a virus? What are viruses and bacteria? So we have bacteria that live all over our body. We have bacteria in our gut. We have bacteria in our mouth. And so we have bacteria. We need certain bacteria. You guys have heard of probiotics. A lot of you guys are probably taking probiotics to balance your different bacteria. When bacteria are overgrown, especially in the gut, you can get a lot of bad problems from that. And if the bacteria gets into your bloodstream or into your tissues, not on the outer parts. So anything from mouth to gut is really considered outside the body. So anything that you take in your mouth and that comes out the other side, that's considered like outside. However, if it gets to the inside places, then that bacteria, then it causes problems for your body. Viruses, these are molecules or proteins that have a piece of DNA and or RNA in them, and they're kind of like a parasite. So they come in your body. There aren't any good viruses per se. There's good bacteria. There's not really good viruses. Some viruses cause cancer, like HPV, and the HPV virus can cause cancer in multiple places, in your butt, your anal area, your throat, and then for women, the cervix. And so that's why the HPV vaccine is recommended. But the goal of the virus is to get into the cells and to replicate and then to spread. So if you guys remember like those, alien movies or something entering the body, replicating, spreading, that's what the goal of the virus is to do. And so when your body sees this virus, it is foreign, and your body will then want to go into attack mode and kill this virus. So how do we kill viruses in our body? A number of different ways. One of the ways is a fever, because the virus is this protein. One of the ways that we, break down proteins is by heating it up, right? So you see, I have curly hair. Dr. Amani has curly hair. So if we take a flat iron and put it on our hair, we're going to break down some proteins and some bonds to straighten that out. And so that's what that's what happens when we apply heat to viruses. We want to break down the bonds, and when we break down the bonds for the virus, then they disintegrate, they die. So what else happens when you have a virus in you? You're going to feel tired, right? So think about the time you guys had a cold or a flu. You're going to feel tired, and that's because your body is expending energy, not on normal functions, but on producing proteins and cells that will be able to fight that virus and kill it. So viruses are foreign invaders, and your body attempts to kill them. So after getting a vaccine is a small portion of a virus, a whole virus, and your body sees that as foreign. And when it sees something as foreign, it goes into attack mode and it wants to kill that virus. And so the vaccine makes your body think it has a virus. It's not the actual virus. And so it's going to do everything it can to go into that same mode. So it's sort of, does that make sense, guys? I'm trying to, and this can be interactive, but please feel free to jump in. So when you normally get a cold, your body, raises its temperature. You're going to feel tired, and that's normal. When you get a vaccine, your body thinks it's under attack because there's something foreign that's in the bloodstream, and so it's going to go into attack mode, and your temperature will rise. That's a fever. And then you'll also feel really tired. So those are normal. And I really wish that, the medical community would change the lingo. It's not a side effect. A side effect is something that happens that we don't anticipate or that is bad for the person. If you get a vaccine and your fever, your temperature doesn't rise just a little bit, or, if you're not tired at all, that might mean that your immune system isn't working well. And so that's actually more of a concern. So now, side effects. I think I presented the last time we were on a website that you can go to.
Dr. Young, if we could just get a little bit of clarification. I know you already clarified it, but just to continue to be clear. It's not that they're getting the virus, is like you said, they're getting a part of the virus and the body is reacting to it as if it had gotten it, which
Exactly.
is actually part of the process that we hope happens.
Exactly. And so most people, after they get the flu vaccine, a lot of people say, oh, I don't want to get the flu vaccine because it gave me the flu. Well, it's not your body actually getting the flu. It is your body reacting as if it had the flu, if that made sense. But it's not the actual flu. So your body is going to go through that same process of raising its temperature, and you're going to be tired because your body is expending energy on, making antibodies, on doing the things that it should do to be able to fight a virus. Okay, is that kind of clear? Did I kind of clear it up a little bit? Okay. So for example, this year when I got the flu vaccine, or the past year when I got the flu vaccine, they made it really, really strong. Okay, and I got the vaccine. I was fine the next day. I think I got on a Friday. I was fine on Saturday. Sunday, I slept all day. I was like knocked out. I didn't do any work, but why was that? Because I have a strong immune system, and my body saw this, that, okay, you're under attack inside, there's internal warfare going on. So we're gonna, take our normal energy, our normal resources, we're gonna put those to rest. What do we normally do? Walk around, we're doing things, reading, working out. And if you're sick, right, you can't do that because you need to be able to rest. So in the same way, your body, when it has that portion of the virus, which will not give you the disease, it will make you really, really tired. And so again, that is something that is expected, and that is not a side effect. So I want to make that clear. So from this point on, you guys know that, you've been educated. Other people will continue to say that those things are side effects, but it's not a side effect per se. So then true side effects, go ahead.
I want to add that, someone had asked in the chat, if we had gotten vaccines, and, I got the vaccine and I had very similar of these effects that Dr. Young is saying. After the second dose, I was tired. I was even confused. I felt like I was, a little bit of a brain fog, and it lasted for a couple of days. Other people in my family got it, nothing. Most of those people that had no effect were also older, who, when they cannot, getting to Dr. Young's part about having a good immune system so you can react to it, right? So I am, I'm not surprised that I also had that type of reaction the week after, just so I wanted to say that. But, I noticed that the older people in my family did not have any reaction, but the younger people did.
And that's because of the immune system.
Right.
So, and that's the other thing that we have to clarify. And one of the reasons, so thinking about that, let's think about the fact that, okay, you, in your body, you were able to make a lot of antibodies after the vaccine or any other virus that you're exposed to right now. However, older people, they're still not able to, what we call, mount the same immune response. They're not able to make as many antibodies. And so even if they get vaccinated, they're saying, oh, okay, it might not lead to death or it might not lead to serious illness, but it doesn't mean that they are 100% protected.
And so, there's a conversation in the chat also about, because your body's not used to it, shouldn't we call it a side effect because of that? But I think the more important part here is that you can expect an effect, right? And so that if you're somehow are under the impression that by getting the vaccine, like nothing is going to happen, you're not going to have any effect at all, that is not the case. You can expect an effect, and you can especially expect an effect if your body is reacting to it in the way that it is designed for you to have a reaction to. And so that's so getting
or
to the point of
what it's supposed to do. Yeah. So a side effect would be a rash. Okay. Also, I don't like to call the area where the swelling, where you get the shot, I don't like to call that a side effect, again, because that is expected. Growing up could be actually, just again, because of the way your body works. When your body goes into that fever mode, there's a whole other system of, it's like a chain reaction that occurs. And so you can, I just saw that in there, you could feel nauseous, but it also depends on, it depends on a couple of different things. It depends on, what your, I don't want to get too technical in this, but I don't really understand what that one says around getting to the point. Well, let me just get to the point then. So a side effect is a rash. Okay, side effects are some of the things that we've seen that are not supposed to happen after you get a vaccine. So you can, you guys can look, and I put this up previously so that you guys can see what side effects have been recorded in the initial emergency use authorization for the vaccines. And so for that, you just go on to you type in the name of the vaccine and FDA EUA, and you can look at the table of contents, and then that's where you'll see what the side effects were beforehand, before it was released. And a lot of that information actually wasn't made available to the public. And so that's where you would find that information. There is the VERS system as well, but that system, people are putting in different things. Or how would you say this? It's not as, it's like every single reaction that people have had afterward is put into that system. And unfortunately, with that type of system, we don't know if it's necessarily due to the vaccine or something else that was happening in the life of that person at the same time.
The next question in the chat is, how many people died from the vaccine?
Worldwide,
I'm reading it from the top.
in the US. So from the vaccine itself, there are individuals who have passed away due to side effects of the vaccine. And so there's several different vaccines. There's the Moderna, right? Pfizer, Johnson & Johnson that are available in the US right now. In other countries, there's other vaccines that are available. Sinovac is available in China. There's also another vaccine, or there's several vaccines that are being made and that are being distributed worldwide. And so the ones that we have in the US are not the only vaccines that are available. And so with each vaccine, you would have to look at, you know, the specific deaths for those vaccines. I have not kept track of every single death that has occurred after each vaccination. And the other thing is that all of the information might not also be presented. There are cases where individuals have had what we call, and this is also looking at the case of the Johnson & Johnson, it caused their platelets to fall tremendously. And it caused their platelets to fall tremendously, and that caused them to bleed. And so those are some issues that have occurred. What it looks like when that happens, the body then goes into a mode where it will try to not bleed, and so it releases a lot of clotting factors. It releases a lot of substances that make something clot. So you guys know if you get a cut on your arm, right, you're going to bleed from that. If you don't have enough platelets, then it's going to keep bleeding, and then your body is going to see that there's a problem, and then it's going to release further factors that'll make you bleed, that will make you clot to try to get that bleeding to stop. And so that's some of the things that have happened with people who have had clots.
Can you take the vaccine being pregnant?
So I will, so I'll take a step back and I'll just let you know how I feel about the vaccine, and let you know that we actually don't know all of the information about the vaccine in the long term. So we don't have all of that information. So you really have to look at what are your risks. If you were to get COVID-19 at this point in time, do you have a strong enough immune system to be able to fight the virus and survive? So I actually had COVID, my family had COVID. My brother is an essential worker, was exposed his family, and they come here to do laundry. So we got exposed, or I did, but my a couple other family members, we were able to separate so they didn't get exposed. However, one of the things to remember is that when you are pregnant, if you get pregnant and get COVID, does a baby get COVID as well? Let me answer that in just a second. But when you are pregnant, your immune system is suppressed. Your immune system is suppressed because there are foreign cells in your body. So you guys have heard about people who have had transplants and they have to take drugs to suppress their immune system, because if there's foreign cells in their body, then their body is going to see that and attack it. The same thing you guys have heard of people or one of the reasons why we check blood to make it sure it's the right type of blood for a person, is that if there are what we call, it's not the red blood cell itself, it is proteins that are on the red blood cell that give them their different types. So if the wrong proteins are on that red blood cell and they don't match the proteins that you already have, then your body is going to see those red blood cells and attack them. And that's why we can't give blood to people of different blood types, right? The only blood that we can give, like the universal donor, is a person who has O negative and RH negative. So it's like negative, negative, and then your body won't make an immune reaction to that type of blood. And the universal recipient, they can take any blood, is AB, because whether it's an A blood or B blood, the O blood already doesn't have those extra A's and B's on them, so they can take any blood. And so again, anything that's foreign, your body will attack. So your body has to suppress its immune system so that your body doesn't reject the baby. Does that make sense? And that's actually one of the issues that we see in women who can't get pregnant, or they'll conceive, but then they'll have multiple abortions, and it's an issue with the spontaneous abortions, and that's because of the immune system. They're not able to hold on to the baby. So the other question, so are you asking about COVID-19 in general or for the vaccine? So for COVID-19, if you get COVID-19, then your placenta is actually really good at helping to protect the baby from getting it. However, because it's going to go through your bloodstream, yes, the baby can get it. So it's sort of like HIV. If there's a virus, if you're HIV positive, does it go to the baby? It can go to the baby if you're not on medications that suppress the virus, if that makes sense. For the vaccine, the vaccine particles, it will still go through, but your baby doesn't have the ability to make antibodies. And so your body, the mother's antibodies to the vaccine will go to the baby, but they won't last very long. Those antibodies will only last until about a year.
And so do we have any data to talk about the vaccine's effect for the developing baby inside of a pregnant mom?
No, we don't. I mean, that's technically research that's not allowed to do. You know, it's what we have something called now the Institutional Review Board, and children and babies, homeless, incarcerated, and the elderly are protected groups. And so it's very difficult to do any sort of clinical trials in those groups.
And so I think the important thing that Dr. Young was saying in response to this question is there has to be the personal weighing of what is the risk to the mother from COVID-19, with balancing it with the long-term effects, which we do not have any information or data about, right, from taking the vaccine. So those are the, would you say that that's correct? That what I just said,
I would say
Dr.
that that's correct. I would say that it also depends on the type of vaccine. If they are not the RNA or DNA-based vaccines, then if they're just a protein-based vaccine, like the flu shot, they're safer. So again, I tend to look at this and and I think the best way to explain it to people, because a lot of people have studied HIV more, is to kind of understand it from that perspective. So if you have a patient with HIV, if they're not well controlled, then their immune system is suppressed significantly. So for people who have HIV, we do not give to them any vaccines that will enter the cells. So those are live attenuated vaccines. And the issue with the current vaccines that are on the market is that they act like a live attenuated vaccine in the sense that they go into the cells. And so we don't know all of the long-term side effects of that vaccine going into the cell. Some of the theoretical side effects would be the development of autoimmune diseases. That's always a possibility. I need to stop reading the chat, sorry, because I keep losing my train of thought. Here, I'm just going to do that.
Yeah, I'll bring the questions to you. I always get distracted by that. I'm always like,
Okay, well, so
that and the fact that I get distracted easily. So hey.
Well, that's okay. That just means that if you were out somewhere and something was going to happen, you needed to move quickly, you would be able to. That's all it means. So anyway, because this goes into the cells again, we don't know the long-term side effects. The other thing with vaccines, and I know this is more in general, even as a parent, I was very adamant about making sure that I knew all of the different ingredients in the vaccines. And as a scientist, looking at, well, how do those ingredients affect the body? So I do think it's important that we look as consumers and we ensure that there are substances or the substances that are being used in the vaccines in and of themselves won't have long-term side effects. One of the issues, and I'll just be honest with you, one of the issues I have with the especially the Pfizer vaccine is that the type of lipid that they use to sort of surround that mRNA, it hasn't been used before, or it's not a normal type of virus capsule, if that's the right way to put it. And so they sort of made it, and so it's foreign. And so we don't know what those long-term side effects are of having that new type of capsule in. And again, what I'm saying is that we have to assess the risk and benefits. The other thing for the Sinovac vaccine, for example, the one from China, that one has aluminum in it. And we know that, yes, it might just be a small amount, but if that is consistently used in multiple vaccines over time, we know that aluminum is implicated in Alzheimer's disease. And so these are the things that we have to think about. And so when we are working with drug manufacturers, these are the things that we need to bring to the forefront. And sometimes folks are not necessarily thinking of that. They're thinking about, how can I, make this product work? But we as physicians and we as consumers, we have to make sure that we go in and we look at the chemicals that are being used. It's very similar to when we enter stores in California, right? We see that there's the sign that says, this building contains chemicals known in the state of California to cause birth defects, cancer, those types of things. And so we as consumers have a right to say, well, we don't want you to use those chemicals in our building. And so those are the things that when I talk about overall vaccines and the components, those are the things as consumers we have to, be forward about.
For the person that was asking the questions around the pregnancy and the vaccine, I hope that clarified. And if you, need more information, please let us know. Okay, and so then the next one is, let's see. Okay, something about I've been seeing videos that magnets have been sticking to where they get their shots. Why is the reason?
So I haven't seen that video. If it's magnet, then that might mean that there's some metal component in it, but I haven't seen those videos. And I don't know.
I haven't seen them.
Yeah, so if it's a magnet, then there would have to be some sort of magnetic charge or some metal. But if you want to put it in the chat and we can, I can take a look at it. But again, I haven't seen them.
I've heard that people who have a history of blood clotting might have an effect to this vaccine. How safe is this vaccine? Because I have a history of blood clotting and I have allergy for typhoid fever vaccine, and I'm scared for getting this. Please advise.
I'm sorry, which vaccine?
For typhoid fever.
So you're saying that
So there, I can read again. How safe is this vaccine? Because I have a history of blood clotting and have allergy for typhoid fever vaccine, and I'm scared of getting this one.
So then I would say I'd have to know a little bit more about the allergy and when you took the typhoid fever vaccine, and like what was the reaction and what happened.
But then they also say they have a history of blood clotting. So just thinking about blood clotting in the vaccines, what is the recommendation around people who have a history of clotting and taking the vaccines?
So with a history, so my thing is if you have like a medical history that's been implicated in any sort of the side effects that have been known to occur, then you shouldn't get the vaccine. Mm-hmm. Okay, that also includes individuals who've had reactions after getting a flu shot, such as Guillain-Barré. That's been implicated. That's a nervous system autoimmune disease. So those are the things to think about.
And then, is it true that the Johnson & Johnson dosage are the worst?
The dosage as far as not protecting against the virus?
No,
so
I'm sorry.
No, please go ahead. Go ahead.
Johnson & Johnson, from what I have been seeing, is been getting a recall for their vaccines, and hospitals have been saying not to get that vaccine, get the other two. So I agree with that.
Yes, and again, the Johnson & Johnson vaccine has been recalled. AstraZeneca was stopped in many countries as well. They use a similar mechanism. The way that they work is similar. And we don't have enough information about, again, the long-term side effects, but then now we're seeing that there are some short-term side effects as well, such as issues with blood clotting. And then again, it'll be in specific groups of people. So the side effects are not going to be in everyone. However, one of the things we can't say is, well, just because like some of the things that folks were saying was, well, it was only 6 people or 15 people out of 2 million. But if you're one of those 16 or one of those, if you're one of those people, then it affects you. I do have a friend from college who was, one of those 1 in a million who, received the polio vaccine. And that was a different one because it was a live virus. These are not live viruses. But then she actually got polio. Yet, of course, in public health, because it's public for everyone, the statements are, well, the risk outweigh the benefit. So the risk of everyone, having an iron lung, or being in those machines again, of, losing the ability to walk, it is a risk. And so we have to consider that. And so we have to consider that before, we also do a lot of other things as well, getting on airplanes, driving, there's risk involved. And so we have to look at that in our lives. So I would say this: if you have a pretty strong immune system, and if you've had COVID and you feel that you can survive, not just feel that you can survive COVID, but you've been around kids, if you get COVID, you're less likely to pass away yourself. However, that doesn't mean that we don't have to protect people who are at risk. And again, the best way to prevent COVID from spreading is to wear a mask. And I know what was said in the media, I know what the president said, but it doesn't necessarily protect those with weaker immune systems, who are not able to mount that strong immune response.
I mean, I think this distinction that Dr. Young is making is really important. You're making a decision about yourself on the level of the individual. The vaccines were made for the level of the population. And then the whole equity conversation is, what about the level of the community, right? Like, so what communities are having access to it or not? They are decisions that are made for those who can take it, right, to take it, with the idea of them protecting those who cannot, or if they did, it would be more difficult. And so, that is not something that can be really appreciated, right? Because of how abstract some of this stuff may seem. But when we see, for example, what's happening in India, or Brazil, or in other places, we also understand that we get to a place where we need to think about things on the level of the group, in order to protect those on the individual. Because when viruses start to go through a community, you want to be able to slow down like its spread. And once again, because Dr. Young is bringing up masks, that doesn't mean that vaccines are everything and that they're the only solution. Unfortunately, we've been put into a corner where that's the one that they're going to invest in, right? They're not going to invest in the other stuff. That's the one that they want to educate the most about, right? They're not going to educate about, like, right now, what the benefits are of wearing the mask. So if we have so many people that don't want to get the vaccine, like, masks are extremely useful, right? And they're not something that should be dismissed. So we're here to talk about the vaccine right now because of the fact that all these other things are not also, right, being prioritized. But vaccines themselves as political projects are projects that are intended to improve the health of a whole, whatever whole that is. But the decision for the individual has to be made, like Dr. Young is saying, for the individual to think about what would be the risk for me to get this virus versus the risk for me to get this vaccine, in this current moment.
The other thing I want to bring up, Dr. Amani, is that so a lot of folks don't have symptoms when they have COVID. Okay, so lots and lots of folks don't have symptoms. What does that mean? And the number one people who have no symptoms when they have COVID are people with super strong immune systems. And who are they? Are little kids over two, usually over 1 or 2. And then kids who are like teenagers, or individuals who are working with kids and they're constantly exposed to, different viruses, and they have a stronger immune system. So when you have that strong immune system, when you're exposed to the virus again, you won't even feel that you have the virus. You won't even feel like you're sick at all, because your body has memory cells and your memory cells will produce proteins, the antibodies that will just go and take out, that virus once it comes into the body again. And so, so I just wanted to really explain that as well, to the point that the people who are most at risk are those that we need to focus on protecting. The people who are most at risk at dying, and that's everyone who has a weakened immune system. So who are they? Like, this is the conversation that I would really like us to be focused on as a country, and to focus on the people who are at risk. So pregnant women are at risk. People who have diabetes and high blood pressure. Anyone who has renal issues. Do you guys have any family members on dialysis? I do. They're at high risk. Other individuals that have heart disease, lung disease. And so when we look at who's passing away from COVID, all we have to do is see where are the highest rates of those diseases in LA County, and what are the populations that have those diseases.
What about asthma and pneumonia?
So pneumonia, you should have gotten over, unless it's, it's sort of a chronic pneumonia. That would be in an older person generally.
Not necessarily. My brothers are chronic asthmatics. So
okay, so that's chronic, chronic asthmatic. That's different than chronic pneumonia. But for chronic asthmatics, yes, they are at risk of any lung diseases, any heart diseases, any kidney diseases. Those individuals are at higher risk. And so even if you're not at higher risk, and this is why I'm telling folks you still have to wear your mask, it's because you might not know that you're infected. And if you don't know that you're infected, you can pass it on to someone else. And even if someone got a vaccine, okay, you have to think about, well, how many times are they being exposed? If they're not able to make that strong immune response, if they're not able to make those antibodies, then unfortunately, they're not going to be able to fight the virus as strongly. Does that make sense? And so yeah, go ahead.
If a person, okay, say a person got a vaccine, right?
Mm-hmm.
They got their 2 doses. I don't know if you said that they can still pick it up.
Yeah, that's exactly what I said.
So what's the point of getting a vaccine if you can still pick it up? Although you can't get sick, you can still pass it.
So what I'm saying is that the people who are at highest risk, they're the ones that we have to protect. And so so let's say that you were exposed. So the vaccine helps you yourself. And that's what I'm trying to explain to people. The vaccine helps you and protects you from passing away, or helps you from having, let's say pretty much everyone on this call who was born after 2000 got the chickenpox vaccine. So if you got the chickenpox vaccine, you probably never had the chickenpox. But I had chickenpox, and I spent a week out of school when I was in 3rd grade because I had the chickenpox. And so, so getting the vaccine protects the individual. And so what I want to separate is for those individuals who, help you from, if you're exposed to the virus, from getting really, really sick. So I did have COVID, and I spent a month like really, really sick. And so one of the things that we look at with the chickenpox vaccine, for example, is you get the vaccine, and then you don't have to miss a week of school. Your parents don't have to miss a week of work. Those are some of the other benefits of getting the chickenpox vaccine. So my kid never My kids have never missed school because of that, because of chickenpox. And so what's the point of getting the vaccine? The point is to protect you from serious or critical illness to COVID-19.
Dr. Young,
yeah.
Can I ask for a clarifying point here that there is also reduced transmission when people are more vaccinated. That doesn't mean that it's eliminated and that people who are vaccinated should not be thinking about the fact that they can also be, like you're saying, asymptomatic transmitters, but that there is also less virus that moves around in a community the more people that are vaccinated. But that doesn't mean that, for that to be maintained, that also requires that the contact level would stay the same. So if I'm as a vaccinated person running around here being like, I don't need a mask, I can do whatever, versus when I wasn't vaccinated, I was a little bit more cautious. I was a lot more cautious. Then I'm just increasing my chances of getting something and spreading it because I think that I'm foolproof, right? Which is, I think the mindset that we want to challenge, that if you're vaccinated, you're not foolproof. But if you are vaccinated and you continue the good practices from before of wearing masks, and you have different ways that you can kind of experience life or whatever, but you still need to be mindful of the fact that you can move it along. I think that's something that's hard to understand, because I can understand Desira's point about then why even get vaccinated if I have to still do everything the same way as before, and and people around me could still potentially get it from me.
Well, I'll use the Disneyland measles outbreak case. So you guys remember when measles broke out in Disneyland? So individuals who were vaccinated, right, they're not the ones who got sick. The people who got sick were the people who were not vaccinated. So we have to remember that it doesn't mean that, for example, because we all, got the measles vaccine at 1-year-old, at 5-year-old, at 10-year-old, and, they checked us later on and make sure that we still had enough antibodies. If the disease is circulating in the community, we're not going to get it. But people, go ahead.
Okay, so if everyone was to get vaccinated, right?
Mm-hmm.
And then newborns come in.
Mm-hmm.
So we can still, everyone's vaccinated, but we can still pass the gene along, basically. So down the line, how long, so corona basically still be around whether everybody is vaccinated or not.
Exactly.
Is basically what I hear.
Yes.
And so down the line, we would still be
vaccinating.
Yeah, children, not children, but because they got to get of age, but we will be vaccinating to keep them from, which will turn into medical bills and stuff like that.
Well, so let's think about our current vaccination model. And then I am going to throw a loop in here, and I know Dr. Amani probably doesn't want me to do that, but I just want to explain another concept, because again, I know that there's a lot of emphasis on vaccines. The vaccine is working. Okay, let me just go back to the babies real quick. So for babies, the babies are able to hold on to the mother's antibodies until about 1 year old. And then they start producing, they have the ability to start making their own long-term antibodies. Before that, they're not able to. They're only able to make an antibody that lasts for 2 or 3 months. That's why for kids, for babies, what's the vaccination schedule? We vaccinate at 2 months. Well, first the hepatitis B, because we don't want them to get hepatitis B from being in the hospital. So they get the hepatitis B vaccine before leaving the hospital. Then at 2 months, they get polio. They, not the influenza shot yet, but they get a series of vaccines. And then at 4 months, they get another set of vaccines. And then 6 months, then 9 months. And then at 1 year, they can get the measles vaccine and other vaccines as well. And so again, we're looking at how that system works. And so for the issue, however, with COVID is that the virus mutates. So again, I want to bring this back to HIV and what we know about HIV, and how it's similar to one of the aspects of the coronavirus, and that is that it mutates. So we actually don't have a vaccine to HIV right now because it mutates very often, and perhaps more often than the coronavirus does. But there's hundreds of strains of coronaviruses. The coronavirus, the normal coronavirus is just the common cold. So most of us can get the common cold and be fine. With the HIV virus itself, for example, because it mutates so much, we don't have a vaccine. With the SARS virus, this is the severe acute respiratory syndrome virus, and this is number 2. That's why it's called SARS-CoV-2. The first SARS epidemic was in 2002, 2003. Because this also mutates, we're going to, one, need more vaccines. So it's not only a 2-dose vaccine. There will be other boosters that will be developed or that are actually in development. They're in development for both Moderna and Pfizer. And the Johnson & Johnson will actually also need a further booster, because you're going to have a booster to the different strain of the virus. So we can now think of this like the flu vaccine. With the flu vaccine, we know that there's a different strain of the flu every year. And the flu that we have, this is the same flu that we've had since that Spanish flu pandemic back in the early 1900s. And it just continues to mutate. But for most of the population, we've built up enough antibodies to the flu virus that when we get sick, it's not deadly like it was previously. And but who is still at risk of the flu? Who's at risk of dying from the flu? It's the same people who are at risk of dying from COVID-19 right now. And so I'm saying currently, not back in the early 1900s, but currently, who's at risk of dying from the flu? And I've unfortunately, a patient who we treated her, but she had problems with her liver, and that weakened her immune system, and she wasn't able to fight off the flu virus. And so also people who have HIV that's not controlled, if they get the flu, they can die. And so what I'm saying overall is that, so why do we give the flu vaccine? It's to protect us. And yes, as Dr. Amani says, it does bring down the amount of flu that's circulating, because once you get the vaccine, what happens? Your body recognizes those it recognizes the foreign particles that are on the flu virus, and then it will attack and kill the virus. So if you attack and kill the virus, then there's less time for it to develop in your body and then to spread to other people.
And so I think also in the chat, there's questions about how did J&J go from making baby products to vaccines in a matter of months?
They have like their hand in everything. So if you look at their products, like their J&J brand, it's pretty extensive. They've been involved with this corporation, or this, it's like a branch of theirs in Belgium. It's actually called Janssen. So that's the company under their umbrella. So if you look at other companies like Procter and Gamble or Unilever, Nestle, Coke, like you'll see, I mean, all of the drinks that you have, your naked juices, like vitamin waters, like those are all owned by Coke. And so a lot of different companies have like an overarching company, and then they have subsidiaries under them. So Johnson & Johnson's one of those that has a lot of different small companies under them.
And they do have recalls in their different products for sure. So it's difficult to tease out the integrity of these companies, which there's zero for all of them. That's just the truth, right? And then the products that they're making that we are in a corner and we need. But yeah, I mean,
as consumers, again, I'll go back to that idea that I was telling you about, as you know, looking at the maquiladoras or the zona franca, right, where people are working for, you know, making $10, $15 a day. But in another country, they could actually live off that. We can't live off that here. Or they can kind of live off of it better than not having a job. But then who actually drives that? It's the consumer. So what we spend our money on has power. So we can choose not to buy certain products. We can choose to not shop at Gap. We can choose to not shop at Banana Republic. We could choose to not shop at Diesel. Like I saw all of these brands down there. You know, I went into the factory and you know, they had all of the production lines for all of these different brands. And again, some companies are better than others. So when I did go to the one for Banana Republic and Gap and Old Navy, they're one company. You know, it was actually clean, and there were bright lights, there was music, people were treated well. I talked to the workers directly. You know, they said that they were treated well. And so like, that's the level of investigation that we have to do with companies. And so as a consumer, as a scientist, as a mother, you know, we have to do that. And this takes us back now to, well, what are some of the things that we're missing in our community? How do we really fight these viruses? We need to have a strong immune system. That's the overall point, right? So kids are not passing away to this virus because, one, they've been exposed to a lot of different cold viruses. And so they already have, there's portions of the virus that are going to remain the same. So they have antibodies already. And so they're able to mount that immune response, even to the parts of the virus that looks the same among the different strains. So that's why a lot of kids are not, you know, getting very, very sick. And that's why they might not even seem like they're sick or have the virus. They're asymptomatic, right? Because their body is able to attack and kill before, you know, they develop any symptoms of the virus.
Dr. Young, since you're talking about kids right now, there's a question in the chat about, you know, right now the 12 to 15-year-olds or those that are between, you know, 1 to 10, so the younger groups. Can you talk a little bit about the expanding age group and safety and vaccines for the younger folks as well?
Yeah, and again, I'm not with the, I guess, majority would say, but I don't necessarily see a need to vaccinate children if we all continue to wear a mask. Especially because, you know, we don't know the longer term side effects. I would like to see these vaccines go through another 2 or 3 years in order to feel safe vaccinating my kids. And so that's my, you know, that's my view. In drug trials, it usually takes 3 to 5 years, and it's really not to see whether it works now. I know it's going to work now, but it's really that longer term. Will it decrease the burden of disease? Well, possibly, but since kids, and I actually have an article about this, They've already done studies looking at the antibody response of children to the SARS-CoV-2 virus, and they have enough antibody from their exposure to the current colds that are circulating to be able to fight the virus. And even if they're positive, they can still pass it on, but it's not going to be as much. Again, who is at risk, right? We have to think about, when we think about schools opening up, if that kid lives with a person who has diabetes, high blood pressure, maybe doesn't have a physician, maybe, they're not controlled in their disease state, then is it safe for that kid to necessarily go to school? It may not be. And so also realize that a lot of things that are being said in the public may not apply to our communities. I mean, my mom lives with me, she's here, she's around the kids. And so, I've already, I'm not sending my kid back to school yet. And that's a choice that I'm making for my family. And so again, we have to look at our individual situations and the messaging that is being given. We have to analyze that for ourselves, our families, and then who is around us. And again, I strongly believe and I strongly encourage you to continue to wear masks. And it's to protect those who who have no antibody, right, to the virus. So we know that kids have enough antibody so that they won't get really sick. The kids who you might have seen who have gotten really sick or passed away, they had an issue with their immune system. Their immune system wasn't strong enough. But our real focus through this pandemic should be on protecting those who might pass away from COVID-19.
And then for the children now who are getting the multi-inflammatory syndrome, there was a lot more knowledge around the treatments of it as well. So if you don't feel comfortable vaccinating your child, but then your child does get COVID, this is where the access to healthcare becomes really important. If they are seeing those types of, reactions, there's also treatment. But Dr. Young, this point that you're getting at with, if we need to slow down to get more of an understanding on what the long-term effects of these vaccines are going to be for children. And in the meantime, what we do know that works, which is stay masked, right? In particular, as schools have reopened and all this, what is unfortunately happening in the pandemic from the day one is that all the other public health recommendations on things to do that are effective are being sidelined because the economic health needs to be protected. And there's a huge investment both in California as well as nationally to make it look like the United States is in recovery, right? That we are not still in the middle of dealing with this issue. And in comparison to other parts of the world, the privilege of living here cannot possibly be more evident, right? Because the vaccines have been effective to a certain extent of reducing transmission, and also just the living conditions and the infrastructure is in such a way that while certain communities have been impacted disproportionately and awfully, that on the whole, it doesn't look like it does, as I've said before, like in India, or in Brazil. But as we know, the variants are already here. We also are waiting to see, and it looks good that the vaccines can protect against the variants, but we are waiting also to see more information about that. And all these other things that we can do in the meantime, and to stop pretending like it's all over. And also then maybe not make decisions that make us so uncomfortable because we don't know what the long-term effects are, right? It's not the same calculation for vaccinating a 70-year-old as it is for a 13-year-old girl, right? That's just not the same calculation, right? But given this, what do how can people figure out what the best decision is when we know that the government is never going to actually really make the decisions that are going to be in the best interest, right? of the whole, and then the consequences of that affect Black and Brown communities more. That's why we started this whole thing off with being like, we're in a corner, and we have to recognize we're in a corner.
Exactly. And so one of the things so I will tell you, how do you survive COVID? You survive COVID by so that's one of the things that we're not talking about a lot right now is if you get COVID, how do you survive? So if you get COVID, you survive COVID by one, staying hydrated, having a pulse oximeter in your home. I used to have one on my desk that I would show to people. Oh, here it is. Right here. So having a pulse ox in your home. Unfortunately, if you have nails, sometimes it doesn't work as well because it can't read, the sensor can't read your finger as well. But
just so everyone knows that these are less than $30 on Amazon.
Yeah.
Just like for the,
pulse oximeter in your home, staying hydrated. You do need someone to take care of you. So someone who's younger, who, if they got COVID, they would survive it. You have to go to a hospital that has an ICU. And I would say go to a hospital that has an ICU with 100 beds at least, 100 ICU beds. So where is that in Southern California? That's LA County, USC. That is UCLA, Cedars-Sinai, UCI. So you have to go to one of those hospitals. If you go to a smaller hospital, then very likely they're not going to have the tools and resources necessary to help keep you alive. The other thing is,
but that also does matter about when and how many people are in the hospital. So you do want to kind of, if you live close to one of those things and you're in an urgent state, it is best to get to them. And right now is a great time to get to them because they're not overrun. Because right now our hospitals are in better conditions than they were. It's not great, but if you could clarify, like if you live close to one of the other ones, then
like if someone is really like, we don't want to get to that point. You don't want to get to the point where it is so bad that you have to go to the closest hospital. Like you don't want it to be a quote unquote trauma situation, right? But then even in a trauma situation, they should take you to a level 1 trauma center. That's what should happen. So if it has a level 1 trauma center, then that's where you should go for your COVID. Like if someone is in respiratory distress, that's where people should go. Okay. How else do you stay alive? Make sure that you have the things that your body needs to make the antibodies. And so, there's a really good video that we have that we put out last spring, and it's by Black Women Rally for Action. And there's Mrs. Timms, who brought her 84-year-old husband home from the hospital, and basically fed him, made sure he had smoothies every day with greens and lemon, basically things that we already know kill viruses. And so I've really been pushing us also to look at antivirals. Antiviral substances is the way that we've been able to essentially confine the spread of the HIV virus in the body and stop the virus from multiplying so much. So looking at antivirals and chemicals or substances, fruits and vegetables that have those antiviral properties in them. They're not being talked about a lot. The FDA is saying, it hasn't been proven. Well, a lot of things haven't been, and actually that's not true because we already have the research articles for them. If you guys want that information, I can send it to Dr. Amani, who can get that to you. But you can survive COVID if you get it. And so essentially it's a multifactorial effort. It's a multi-strategy effort to keep our community safe. And again, I'd really like us to keep in our mind who is most at risk and how can we protect them. That's what we have to focus on right now. This shouldn't be an issue about masking. In other countries, they've been wearing masks for centuries, to help protect other people, protect the society as a whole. And so, unfortunately, this isn't a conversation that I can give you that says, yes, absolutely take the vaccines. No, absolutely don't take the vaccines. We have to do the research. We have to be able to look at the nuances and the factors. And we have to be able to evaluate, what's being said in the media. Like I'm getting these New York Times articles that are saying, oh, the science shows that, there's no spread, outside. Well, that outside may not count if you're at a swap meet, right? If you're walking your dog around your community and there's no one around you, sure, maybe there's no spread. But that also tells us that we should be doing everything outside. They're not saying that, right? So we have to evaluate what's being told to us, and then we have to see how does it apply to our lives.
So I really want to just hyper focus on what Dr. Young is saying around nutrition, and that nutrition is not anything that we should ever let go of, regardless of whether they want to say they proved it or not. We know that nutrition is super valuable with the foods that are naturally protective against, from viruses, and that for those of you who choose to get the vaccine, nutrition is something that's really important for after you get those doses as well, staying hydrating and your nutrition at that point. So it's not just, this is not just something for those who are unvaccinated, to think about. And so, there's conversation.
If you don't have the proper vitamins, then you won't be able to make those antibodies. You won't be able to make, you need vitamin C, for proteins, like you need, or for many different structures as well. So you have to have those basic things. And unfortunately, how many GNCs or vitamin worlds do you see, like in South LA? Like I haven't really seen that many. You have to go to, CVS or Rite Aid to get those. And so, we have to, what we really have to do is realize again, and I can't keep saying this enough, but who is at risk? Who's at highest risk, and how can we get them healthy? How can we protect them? How can we take care of them? This idea that, oh, if I get vaccinated, then I get to do X, Y, and Z, that's really a selfish view. And the view should be, what can we do to keep everyone safe? And that's the way that we should be approaching this.
There's, conversations in the chat about, why is it that, for example, we have, I think the example was with AIDS for example, why does HIV not have a treatment yet, right? Why is there no vaccine, or there's treatment for HIV, why is there no vaccine for HIV? And then, so
there's no
essentially
vaccine.
Because it mutates, right? And so the tension that I see here in a couple of these comments back and forth around, why do we have treatments for some things? Why do we not have vaccines for others? And why do we invest in one versus not in the other? It's important to see that if they can make it, they kind of will if there's markets for it. And coronavirus, there's a market for both the treatments and the vaccines. Just like in flu, there's a market for both the treatments and the vaccines. So I understand that we cannot trust these people and that we should be always vigilant and monitoring their behaviors and actions. And having the evidence be reviewed multiple times. But in the COVID situation, Pfizer has both a vaccine and it's also in development for treatment as well. And so with COVID, there will definitely be both.
It's also looking at political power. So who or who's influencing, who's lobbying? We can also ask the question, why don't we have a cure for sickle cell disease? Well, you know what? We actually do, and it's bone marrow transplant. But are they willing to pay for it? That's the question.
Excuse me.
Yeah.
I gotta go. I just wanted to tell you guys thank you for being here and giving me the information that I needed to know. Thank you.
You're welcome.
Can I put our emails in the chat so that if you have more info, because you know, these conversations, like they go into many directions because there's so many things that we have to talk about. And so if you have more, I put my email there, you can email and we'll be happy to get it to the right expert, you know, who can
Thank
answer
you.
for you. And so we have, you know, less than, you know, I think the 5-minute mark was given to me 5 minutes ago. You know, I just want to, you know, say again, thank you, Dr. Young. It's a lot of information. I know that there's many parts of it. You know, you are generous with your time and you start where you think we need to start, but then you also need to give us the information that sometimes we don't know we need as well. I want to, you know, just mention for the folks who are talking about liability and holding these companies like accountable when things go wrong. You know, you see that happens, but that doesn't really mean anything in terms of how much profit they make. So they can be held liable and they can pay out lawsuits, but it's still very like financially beneficial. You know, but these technologies, they come and they are made from us. They, you know, we use them. When we use them, we give them evidence. That evidence helps to make them stronger. You know, in the history of this country, like people's bodies have been used to develop this stuff against their will, right? You know, so while they're the ones who take it to the finish line and get the benefits of it, you know, we are also key and instrumental into them being able to even come forward and have these technologies. And it's also based on sciences that come from places that we come from, right? Places that are, you know, the idea of vaccination and inoculation and developing antibodies to something before you see it because it's protective is not something Pfizer, Moderna, or Johnson & Johnson came up with. Like, you know, these are traditional knowledges from Africa, from different parts of the world, right? So, you know, that's also to, you know, to keep in mind, you know, as we move forward and we go through this. For those of you who've gotten the vaccine, anything and everything that you don't feel like is right, I really encourage you to report it to some system, whether that's your physician or to the online opportunities too, because that's the information that we need so that we can be able to come here and do this even better, right? Like if we don't hear it, and if it's not starting to be documented, then we are only able to report back and share what a group of people shared about their experience. We're not able to share what everybody, right, was experiencing. So for those who got it, continue to stay, you know, to stay connected and to share about your experiences because we'll need that information as well. Thank you, Jesus, for inviting us. We would, you know, love to, you know, continue and to stay connected.
Well, thank you for your time and your honesty, both of you. I think I think people were expecting that you were gonna, you know, tell us go ahead and go take the vaccine, but you guys were really honest about it. So really glad to have you guys here. Thank you so much, and thank you, Fresno. I didn't realize Fresno was here. All right.
Thank you, Doc Yang, Doc Amani, and Jesus. Actually, I wasn't able to get in with my question a while ago. This is Mrs. Gamit. Because I experienced a blood clotting when I was pregnant, and then I have a massive bleeding when I went out of the hospital, and I'm diabetic. And I have a history also of allergy of that typhoid fever vaccine. So I'm a little bit scared of or if I will get the vaccine or not. I'm really interested, but then that is my concern. And then I emailed my doctor regarding that concern of mine. But then they just gave me the ingredients of Pfizer and Moderna of how will I get in with the regarding the ingredients of that vaccine that I have allergy. But then they did not point it out to me that if I will be safe on this or not. That's why at this time, I'm not getting the vaccine yet.
Okay. I mean, and I think that's a smart decision. And, you know, like I said, I don't think you should, like, no one should fault you for that. There shouldn't be people who, you know, shame you into, you know, getting the vaccine, even if you're a healthcare worker. And so one of the things I will say is that there are other vaccines that are being developed that are different, and we can look at those ingredients. But really, what we do know is that for some of the vaccines that are coming out, one that I was hoping was going to come out sooner, but it got pushed back again, it's the Novavax vaccine. It's like the flu vaccine, and we have years and years and years of history with the technology that produces that vaccine. And so I would say overall that's a vaccine that should not necessarily have any long-term unknown side effects, because we have that history of how that vaccine works. And again, the only thing that we'd have to look at is, the ingredients, and then again, be able to, weigh the risk and balances of those ingredients that are inside the vaccine. But one of the things that you can do is, Ms. Gamet, is to look at the ingredients and see, what are the normal side effects for those specific ingredients. And again, the ingredients, the side effect is something that that is an abnormal reaction. It's a non-normal reaction. So a rash, does it cause in people, has it caused any sort of difficulty breathing? So those are the things that we have to look at. And again, like I'm saying, when we're in these conversations, not in the public health conversations, like I want you guys to do just like what Ms. Gamet is doing, and looking at your own situations and your own family circumstances.
Okay, thank you, Doc. Yeah,
You're
that is what my doctor said, that I need to look over on the ingredients of that typhoid fever vaccine that was introduced to me, because I was really have trouble of breathing already when I first took that vaccine. That's why.
Yes.
That's why they are asking me to look over on those ingredients of the vaccine for COVID and what are the side effects on it. Okay.
Mm-hmm.
Thank you.
You're welcome.
Well, thank you, everyone. And, if you would like for us to come back, at another time, just let us know.
Thank you.
Appreciate both of you again.
If the new vaccines come out and we can talk about those, I'm happy to talk about those as
Mhm.
Jesus, are you able to share us the link for this one, the recorded video?
Oh yes, I'm definitely gonna. Yeah, it's gonna take. It takes a while to extract the recording, but I'll go ahead and send that email.
Okay.
As soon as
Thank
I
you
can.
so much. Thank you, Doc. Thank you.
Thank you.
You're welcome. All right, have a good day, everyone.